स्टार्ट कर दो।
गुड आफ्टरनून ऑडियंस। आज डेयर की तरफ से हम हमारे मेंटर डॉक्टर मनीष आ रहे हैं और हमारे बाकी मेंटर्स भी आज साथ में हैं। डॉक्टर नीलम,
या
वेलकम मैम।
थैंक यू या
ओवर टू यू मैम।
ओके, हेलो डियर फ्रेंड्स। डेयर की तरफ से आज हम डॉक्टर मनीष जगपाल का लाइव सेशन कर रहे हैं ऑन फीवर्स। तो डॉक्टर जगपाल को कोई ज्यादा इंट्रोडक्शन की जरूरत नहीं है, क्योंकि ये लुधियाने के वन ऑफ द बेस्ट डॉक्टर्स हैं और आज ये फीवर पे बात करेंगे। तो सबसे पहले थोड़ा सा अबाउट डेयर। आई एम प्राउड टू बी पार्ट ऑफ डेयर, क्योंकि डेयर में जो हमने 1 जैन को अनाउंस किया था कि हम हर वीक एक मेडिसिन लेंगे, तो हर वीक वही सेशन चल रहा है। हमारे डॉक्टर संजय, डॉक्टर योगेश मल्होत्रा एंड मनीष एंड डॉक्टर मनिंदर, ये सभी हम लोग एक हफ्ते में एक मेडिसिन कर रहे हैं। सो वी आर प्रोवाइडिंग अ बिग प्लेटफॉर्म टू ऑल आवर डॉक्टर्स। आज भी हम उसी की शुरुआत कर रहे हैं जूम सेशन के थ्रू। डॉक्टर मनीष जगपाल, आई वेलकम एवरीवन एंड आई वेलकम डॉक्टर मनीष टू फॉर हिज सेशन। Dr. Yogesh, you say something about DARE and something about Dr. Manish. Over to Dr. Yogesh Malhotra.
Thank you, ma'am. DARE के बारे में जैसे आप सब जानते हैं, am I audible ना? मैं सुन पा रहे हैं आप?
Yeah.
ठीक। DARE के बारे में आप सब जानते हैं कि हम काफी देर से रनिंग प्लेटफॉर्म, और हम कह सकते हैं कि जो न्यू स्टूडेंट की क्वेरीज हैं उनको बहुत अच्छे से ले रहे हैं और टुगेदर वी ग्रो, हम सब ग्रो कर रहे हैं इस सिचुएशन में।
वो लेफ्ट हो गए डॉक्टर योगेश मल्होत्रा।
I'll speak something about DARE.
Yeah.
शुरुआत जब DARE से हुई तो I remember those days, WhatsApp के ऊपर ग्रुप बना, वहाँ पे काफी स्टडी शुरू हुई। ऑथेंटिकली मैं अपने दिल से बोलूंगा कि शुरुआत में मुझे ये आइडिया थोड़ा लगा कि WhatsApp पे पढ़ाई करना कोई बहुत अच्छी बात नहीं है, ऐसी मेरी फीलिंग थी तब। तो प्रोमिला दी से भी मैंने बात की, मैं कहा यार इवन आज भी मैं बोलूं अगर, तो मुझे WhatsApp से दिक्कत आती है कभी कभी। तो मैं कहूंगा कि ये बहुत अच्छी शुरुआत है कि हमने जूम पे इसको करना शुरू किया, लेकिन वो दिक्कतें होने के बावजूद मैं जो भी कहूंगा, जो मेरी सोच थी उसको डेयर की पूरी टीम ने परास्त किया। एक नई सोच सामने लाई और जिस तरीके से प्रोमिला दी ने इसको कंटिन्यू किया इतनी शिद्दत से, कि आज मैं कहूंगा कि मुझे I am proud to be part of this team. The amount of perseverance and amount of efforts the whole team has put in, especially under supervision of Promila Di. तो आज मेरी वो सोच बदल गई है। इंसान कुछ भी करना चाहे वो कर सकता है, चाहे वो WhatsApp पे हो, Zoom पे हो, Facebook पे हो। नियत और शिद्दत होनी चाहिए। Over to you, Yogesh sir.
सॉरी, इंटरनेट ब्रेक हुआ बीच में। कुछ इशू आ रहा है। अच्छा, सबसे पहले जो सबसे इम्पोर्टेंट मनीष, द टॉपिक यू हैव सिलेक्टेड, आई रियली लव दिस टॉपिक। ये बहुत क्लोज है मेरे दिल के, क्योंकि जब भी नॉर्मली कोई भी स्टूडेंट निकलता है कॉलेज से, और मैं अपना एक्सपीरियंस बता सकता हूँ, एक टाइम था जब हम कॉलेज से निकले तो हमें ऐसा लगता था कि वी कैन डू वंडर, यानी कि बहुत कुछ कर सकते हैं। पर मोमेंट वी सिट ऑन ए चेयर, जब हम जाके बैठे और जो पेशेंट आए, जो हमें एक्सपेक्टेड पेशेंट थे वो तो नहीं आए, We are expecting a lot of deep pathologies and rheumatoid arthritis, cancers, which we normally see in the clinic जब हम अपने seniors के साथ बैठते थे. तो तब जो patient आए वो आए fever के, cough के और छोटी छोटी प्रॉब्लम्स लेके आए. उसमें फीवर एक सबसे मेन था कि टाइफाइड है, जहाँ इन केस डेंगू है, जहाँ और भी है, और पायरेक्सिया ऑफ अननोन ओरिजिन है. तो उस समय वी फील कि यार करें क्या. बेसिकली जो हमने सीखा था, जो हमने पढ़ा था, वो ऐसे लग रहा था वो काम ही नहीं आ रहा. सो उस मोमेंट पे हमें एक तरह से, जैसे हमें कहते हैं ना, सिस्टम रिबूट करना पड़ा. हमें अपना सिस्टम रिबूट करना पड़ा, बेसिक्स पे शिफ्ट करना पड़ा, और कितना कुछ था जो हमें सीखना पड़ा दोबारा से.
एग्जैक्टली.
बिकॉज एट दैट टाइम हमें वो गाइडेंस नहीं मिली जो मिलनी चाहिए थी, जो मुझे लगता है, जो हमें यानी कि लगता है कि आज, इसीलिए शायद डेयर का ये पर्पस भी है, इसीलिए कि वो प्लेटफॉर्म देना, जो यंगर वन है उनको प्लेटफॉर्म देना, और उन सबको वो दिखाना कि जब आप क्लिनिक पर बैठोगे तो आपको क्या सामने दिखेगा, पेशेंट क्या प्रॉब्लम्स लेके आएगा, उन प्रॉब्लम्स को कैसे हम सॉल्व करेंगे. आपको हम इसी डेयर के प्लेटफॉर्म के थ्रू हम हेल्प करते हैं हम सबको. सो वैसा ही आज का पर्पस है कि ये जो प्रॉब्लम्स हैं, कि फॉर एग्जांपल फीवर है, कफ है, पेन्स हैं, कोई एक्यूट इश्यूज आ रहे हैं, उसको कैसे सॉल्व करना है, क्योंकि उसी से ही क्रॉनिक पेशेंट बनेंगे और उसका ट्रस्ट बनेगा. अगर बीपी के लिए, जहाँ ट्यूमर के लिए या किसी के लिए पेशेंट तो आएगा अगर हमने उसका टाइफाइड या फीवर ठीक किया होगा. अगर फीवर ही ठीक ना हुआ तो वो क्यों आएगा मेरे पास. So that is why this topic is very close to me basically. So I know you will do justice with this, or open your heart. On the behalf of DARE and whole team, I welcome all of you in this session. Start karte hain, Manish.
Thank you, Yogesh bhai. I have always learned a lot from you, and I believe I will keep learning also. और बिल्कुल आपने सही कहा कि सेमिनार जैसे सेमिनार अब होते हैं वैसे नहीं होते थे पहले. I believe Hindi is okay, or should I be only in English?
नहीं, हिंदी प्लस इंग्लिश.
Okay, got it. So सेमिनार्स में देखते थे कि कैंसर ठीक हो गया, हड्डियां टेढ़ी थी आरे के साथ, पेशेंट की सीधी हो गई. और कुछ सेमिनार्स ऐसे भी होते थे जो शायद लंच टाइम के बाद भी शुरू नहीं होते थे, उद्घाटन ही नहीं शुरू होता था कई बार. बट आई थिंक टाइम्स हैव चेंज नाउ, पीपल हैव स्टार्टेड कमिंग स्ट्रेट टू द पॉइंट. बट उन सेमिनार से हमें द पॉजिटिव थिंग वाज कि ये देखने को मिलता था कि पेशेंट्स ठीक तो हो रहे हैं, बट पेशेंट ठीक कैसे हो रहे हैं, what was actually done, what was actually understood, and what was actually the application of that understanding, that used to be bit less. I think शायद इसीलिए जोश तो बहुत होता था कि हाँ इतनी बड़ी बड़ी बीमारियां ठीक हो रही हैं, but how to apply it, how to apply the knowledge, that was kind of missing. So I'll start sharing my screen. Allow Zoom to share your screen. I think मुझे कहीं restart. I will have to rejoin because वो permission मांग रहा है. So I'll join again in 3 seconds, right? Sharing
Okay.
it. Yeah.
मैम तब तक आप बोल सकते हैं अगर कुछ आपके व्यूज है तो, ये साइलेंट मोड के बजाय.
ओके, मैं बोलूं?
हाँ जी, 2
बिल्कुल
मिनट
बोलो.
ओके.
रखने से तो बेहतर है.
थोड़ा सा नील सेवन.
वैसे उन्होंने ज्वाइन कर लिया दोबारा से, लेकिन मैं मुझे इस बात की बहुत खुशी होती है कि जैसे हिसाब से प्रॉमिला ने इस ग्रुप को इतने सालों से इतनी डेडिकेशन, इतनी सिंसेरिटी और प्यार एंड विद strong
Danda.
hand. ये संभाला है. So that is hats off to Promila.
डंडा
Yeah.
नाली है मैडम.
हाँ जी.
डंडा भी नाली है.
अरे नारियल है,
That's why I
नारियल.
said strong hand.
डंडा सिर्फ योगेश को दिखा और किसी को नहीं दिखा.
हाँ.
मुझे I see only strong
नहीं.
hand.
हाँ दिखया सारे में बोलता कोई नहीं है.
नहीं, मैंने भी दिखा है यार.
थोड़ा जरा पॉलिश करके ऐसे बोले आ strong hand. So this is like डंडा. Yeah.
मैम पर वो सिर्फ डेयर के अंदर है, डेयर के बाहर मैं बहुत ठीक रहती हूँ.
I know. मेरी फ्रेंडशिप आपकी और मेरी फ्रेंडशिप इसी उस पे हुई थी. आपने मुझे कॉल किया था. I didn't know you. तो डेयर के थ्रू ही हमारी बात हुई. या
नहीं वो
चलो
डिसिप्लिन के
अभी
लिए डंडा, अदरवाइज आई एम टोटली ओके. बिल्कुल
या आई
नॉर्मल.
नो. या चलिए डॉक्टर मनीष जी करिए स्टार्ट अपना सेशन.
Thank you, ma'am. Thank you.
या
So welcome everyone.
हाँ जी मनीष, प्लीज
How
कंटिन्यू.
can I put my screen?
हमें दिख रही है आपकी स्क्रीन.
Okay, you can see it.
हाँ.
Great. Okay, so I will start with this. What is this? Okay. एक छोटे से केस से स्टार्ट करते हैं. ये this is not my case. This is a Hanneman's case. The student was Egedi. So he was okay. He was sitting with Hanneman and watching him कि Hanneman sir क्या कर रहे हैं. तो एक बच्चा आया उनके पास जिसके बहुत सारे वार्ड्स. Hanneman sir ने केस लिया, उसको दवाई दी. एडेगी ने उन्हें पूछा कि आपने क्या दवाई दी है. He told that, आपने अभी मेरे साथ बैठे थे, आपने केस देखा, आपने सिम्टम्स देखे, तो आपको रेमेडी मालूम होनी चाहिए थी. हैनीमैन ने रेमेडी नहीं रिवील की. लेकिन एडेगी थोड़ा चुस्त भी था और क्यूरियस भी था. तो I want everybody to be in communication with me on the chat. So if you can share, anybody remembers कि क्या रेमेडी दी थी उस वॉट्स वाले बच्चे को हमारे मास्टर हैनीमैन ने. Anita Chavla. China is little close. No, not Sina, not China. और क्या रीजन रहा होगा कि हैनीमैन सर ने दवाई नहीं बताई कि इतना पूछने के बावजूद. Anybody out of the students? क्या आप चैट बॉक्स में बात करते रहोगे ना, तो I'll feel that you guys are listening and understanding me. I want everybody to participate in the chat box with me. Very nice. Yes, Patel. इसीलिए नहीं बताई कि prejudice ना होने का. Very, very, very nice. Ved Singh ji, Chamomilla, especially in 30 potency was given to that child, and the child came on follow-up, and he was markedly improved. Now, the reason for sharing this case was that remedy is not important. The application of the remedy. That's the reason Hanneman did not share कि क्या remedy दी गई थी. So that is the same way I want everybody to look at the cases we are going to share with you all today. Don't just look for the remedy. Try to look for the application of the understanding. So very simple case, 5-year-old boy carried by mama, came very high fever. So high that if I would bring the hand close to the face of the child, I could feel the heat from distance. Red face. And he was little delirious along with moaning. बड़ा restless था. किसी भी चीज से उसे आराम नहीं मिल रहा था. But one thing I noted was that mother was along with the child confused कि मैं इस बच्चे को ढक के रखूं या इसके कवर्स रिमूव कर दूं. Even the child was not, able to. एक मिनट वो कहता था मुझे ढक दो, जो छोटा सा कंबल लिया हुआ था मेरे ऊपर दे दो. थोड़ी देर बाद वो उसको खुद रिमूव कर देता था. फिर उसे कुछ अंदर से महसूस होता था, वो फिर कंबल ले लेता था. I got up and tried to feel the patient and एक अजीब चीज मुझे मिली कि उसका एक हाथ गर्म है और दूसरा हाथ ठंडा है. And similar thing I felt on his feet also. So I asked the mother, what is this? Mother also confirmed कि ये जो ठंडक है ये आती जाती जा रही है. कभी कोई पार्ट इसका गर्म हो जाता है, कोई ठंडा हो जाता है. When I was checking out the other parts of the child, I could see कि उसके जो uncovered parts हैं चेहरे पे कहीं भी पसीना नहीं था, but parts that were covered, they were sweaty, and the child was thirsty. So I want all of you to come up with the suggestions. Small cases we'll share today, but out of which I believe I will be able to share something. So I want your suggestions. What should we think? How should we proceed? I hope my voice is loud and clear to everyone.
Yes, it is clear.
So I'm waiting for the suggestion in chat box.
Come on, doctors, please answer कीजिए.
Somebody can raise their hand if they want to speak. We can unmute them. Very simple and small case it is. Anita ji is saying Thuja. Very nice, Anita ji. Dr. Meenakshi is saying Laiko. Can everyone also provide a reason? आप बिल्कुल चिंता नहीं करो, आप गलत दवाई बोल रहे हो, सही दवाई बोल रहे हो. Forget about the right and wrong and just participate, because that will just make you think a little bit. I believe this COVID has also taken away one privilege away from us, that we are now talking to the computer screens. Okay, Meenakshi is saying 1 foot hot and another cold. Alam is saying, let's give placebo. Great. I think Alam ji has raised hands as well. And Anita ji, what is why you chose Thuja? Very nice. Patel Manthan sir is saying arsenic album. Frequent thirst, restless. Very nice. Hussain Ali ji is saying stramonium. So we have Thuja, Lyco,
Deepa Gupta, Sina.
placebo, Stram, no sweating on uncovered parts, Thuja. Very nice, Anita ji. Dr. Zahid is saying herself.
And Facebook पे भी मनीष कुछ आए हैं. ओम पतिदर की तरफ से आया थुजा.
Right. Right. So let us summarize the case again and see and look about the remedy suggestions as well. Arsenic क्योंकि उसको कभी गर्मी लग रही है, and thirsty also. Great. So क्या थूजा acute high fever ऐसी पैथोलॉजी जो सडनली आई है, बहुत एक्यूटली आई है और हाई फीवर है साथ में. लाइको का बड़ा अच्छा सजेशन है अगेन, बट विल लाइको प्रेजेंट लाइक दिस इन सच एन एक्यूट स्टेट? सो आप सबकी रेमेडी सजेशंस बहुत अच्छी है, बट वी हैव टू थिंक अबाउट द कॉम्बिनेशन ऑफ दीज रेमेडीज, क्योंकि एक कुछ चीजें एक रेमेडी में प्रेजेंट है, जैसे थूजा में पर्सपिरेशन का कैरेक्टर प्रेजेंट है, बट बाकी चीजें प्रेजेंट नहीं है जो केस में. पेशेंट इज वेरी थर्स्टी. And perspiration on covered parts. Along with that, we need to see, very nice, Arshia. One hand cold, other hot. What is the reason of this? Patient is covering and uncovering again and again. So what are we looking at? This whole totality has to be, strongly present. And let us look how I understood this case. And let us understood what is the Arshia congratulations. See, very important thing we need to understand in aconite is that the high fever has just started today. It is the onset of today only. And the fever is so much high that you can feel the heat from distance. Fever has gone so high that child has started moaning deliriously. And there is nothing that is ameliorating the child at this moment. So wind of the acuteness is quite high at this moment. And one important thing, let us read aconite a little bit. Not only the repertorization part we need to understand. See what rubrics I took. Uncovering desire for, but when he uncovers, he starts feeling chilly. Then he covers again. But the more important symptom I want you to understand is there is a partial burning fever. The heat is partially coming and going to the various parts. एकोनाइट की जो फीवर की ऑनसेट की स्टेट होती है, उसमें हीट और चिल स्टेज इतनी फास्ट होती है कि वो एक दूसरे में मर्ज कर जाती है, because of which patient gets confused in this acute state and cannot actually differentiate ki am I feeling hot or chilly. If you see this, restlessness, anxious, and if we remember, the perspiration of aconite is very peculiar. That is only on the covered parts or the parts that are touching the bed. See, the symptoms are very violent and painful. I need to take this away, yeah. Oh, thank God. The chat was covering my... Sudden loss of strength with collapse, along with,
Dr. Zahid is raising hand.
Okay, he wants to talk about something.
Dr. Zahid?
No, sir. Mistake.
Okay.
So we want to understand that the circulation is the main important thing that gets affected. There is congestion of single parts and also the coldness of other parts at the same time. If you will see, there is a very important symptom of aconite that one cheek is hot and red and other is, see, becomes pale and red alternatively. Red face becomes deathly pale on rising. One cheek red and hot and another is pale and cold. So just understand this state. What is this? This is the center of aconite. This is the pathophysiological expression of the aconite that I want you to understand. That suddenly there is a rush of blood to one part and another state also appears suddenly and they intermingle into each other, which produces this. Otherwise, first year I would used to think, how can one, if the patient is having so high fever, तो एक गाल उसकी इतनी गर्म और दूसरी गाल उसकी इतनी ठंडी क्यों है? Because there is a turmoil in the circulation, which is suddenly producing heat also in some parts, but also suddenly producing chill in other parts. So, am I making sense to everybody? I was sure this aconite is going to produce good result. Didi. See, within few hours, the fever went away. The expression on the child's face, which was very, disturbing, that became relaxed and child started demanding for the food as well. Great. And patient, doctor, both happy. Let's move to another case. This middle-aged man came, and what is he saying? Understand this, that I have a feeling that fever is about to start. Doctor, yesterday I felt chilly. मेरे को इतनी ठंड जनरली लगती नहीं है, लेकिन कल से मेरे को ठंड लग रही है. और कल ऐसे मैंने मैडम को बोला कि मुझे आप सिंपल कंबल नहीं, मुझे मोटी वाली रजाई दो, एंड आई स्लेप्ट फुली कवर्ड, फुली कवर्ड। और मैंने पूछा सबको, आप सबको ठंड लग रही है क्या? बट द patient, the relatives replied, no, I am not feeling as chilly. So let your suggestions come for this small cases. We need to understand what might be happening in this case and what should we do. So what his purpose to coming to me was कि आप इतना मुझे ऐसी दवाई दो कि बस ये जो फीवर स्टार्ट होने वाला है ये ना हो। Come on, dear, you can participate better. Anita ji, Meenakshi, very nice, very nice. Exactly. Bang on, you guys. I gave Nux vomica. If you see fever, anticipating, in Kent, 3 marks, only remedy is Nux vomica. But not only this symptom, if you understand Nux vomica, he was pre-expressing few symptoms. So I know somewhere it is written, they will want to stay fully covered in all the stages of fever. To find out where it is written, yes, must be covered in every stage of fever, and least uncovering aggravates. So this was the symptom he already started expressing. Cannot move or uncover without being chilly. So ये छोटी छोटी चीजें हैं जो हमें पकड़नी है पेशेंट की लैंग्वेज से जब वो एक्सप्रेस कर रहा है। Again, very interestingly, he did not had this fever, and we could prevent this that was about to come. We'll discuss the summary of all the cases after some time. Let us go further and talk about one more case. This patient was COVID positive. So I took the call on the phone by some relative. And what is he complaining? Mainly complaining about his throat, that doctor, 4-5 दिन से मेरा गला, खांसी, जुकाम बहुत ज्यादा हो रहा है, और डर के मारे मैंने एंटीबायोटिक्स, एलोपैथी एज यूजुअल, हमारे कोविड पॉजिटिव जब रिजल्ट आता है तो दे टेक पैनिक मेडिकेशन, बट that is not relieving his cough, cold. Maybe the fever is going down with the allopathic medication, but it is coming back at a very high pace. So what is happening, that he is fed up of his medications. उसका माउथ जो है वो कड़वा, टेस्ट कड़वा हो चुका है, उसका नोज ब्लॉक्ड है, स्पेशली जब भी वो लेटता है, and whenever he lies down and tries to sleep, there is profuse sweat, profuse sweat. हमारे पहले पेशेंट में भी काफी स्वेटिंग थी, बट इसमें ऐसा कुछ नहीं था, कवर्ड पार्ट्स में हो रहा है या अनकवर्ड पार्ट्स में हो रहा है, बट पसीना बहुत आ रहा था, and he wants to uncover. But again, when he uncovered, there was lot of chilliness, not only chilliness, but chilliness with shivering and trembling. And then he would take a lot of quilts, 1-2 quilts with blanket along with that. And then after that, again, the sweat stage will come, lot of perspiration with weakness. And कहता टांगों में मुझे इतनी बेचैनी हो रही है रात को और दर्दें हो रही हैं, कभी दर्द ऊपर से नीचे को जा रही है, कभी नीचे से ऊपर को आ रही है, कभी काफ से थाई में पेन आ रही है, कभी थाई से काफ में पेन जा रही है, कभी पैरों में दर्द जा रही है. And he is so bothered by his obstruction of nose that जब भी मैं लेटता हूं मैं सांस नहीं ले पा रहा हूं, पानी भी कड़वा लगने लग गया है. और फीवर क्या है, फीवर बहुत हाई आता है. He feels like 103-4 बुखार आ गया है, थर्मामीटर में चेक कर रहा है. But when this perspiration comes and he checks the fever again, वो फीवर नॉर्मल आ रहा है. तो उसे लग रहा है उसका थर्मामीटर खराब हो गया है. डॉक्टर साहब बुखार वगैरह तो चलो है चल रहा है, बट माय थ्रोट इज बिकमिंग मेन कंसर्न. इसमें जलन होनी शुरू हो गई, इतनी दर्द हो रही है कि मैं ऐसे स्वॉलो भी करता हूं तो वो जो पेन है वो नॉर्मल पेन से अब बर्निंग में कन्वर्ट हो गई है. जितनी खांसी आती है तो इतना दर्द होता है गले में, आई कांट डिस्क्राइब. So overall, he is frustrated from all this state of fever coming up and down, cold perspirations, burning pain in throat, bitterness of mouth, obstruction of nose on line. So very nice. Let's have suggestions for this case as well. Arsenic album, bryonia. Give your reasons. See, मैंने पहला एनिमन सर का केस इसलिए शेयर किया कि वो हमें जर्नी पकड़नी है पेशेंट की डिजीज की. डेस्टिनेशन will arrive right or wrong doesn't matter. तो हुसैन अली जी, आर्सेनिक, very nice choice. But what is reason for that choice? Bryonia for bitter taste in mouth. Very nice. Very nice, Ojasvi. Yes, Hussain Ali ji, definitely lying down aggravates the restlessness. But we need to also see कि वो restlessness located कहाँ है. Especially in the lower limbs. Ojasvi, Bryonia उसका बिटर टेस्ट तो डेफिनेटली कवर कर रहा है, बट क्या और कोई और रेमेडी पॉसिबल है जिसमें ये बिटरनेस भी कवर होती है और पेशेंट की बाकी पेक्यूलियर स्टेट जो है वो भी कवर होती हो. I'm writing my understanding. How do I understood the case? Sachin is saying mercurius. Very nice. How, Sachin? Why are you suggesting mercurius? अच्छा, ये फीवर किस तरह का है? What kind of fever this patient is going through? We need to see what kind of pathological expression Yes, Ridhima, it is an intermittent fever. Very nice. Because it is touching normal values as well. And what kind of intermittence it is? Fast and quickly that is happening. It's like almost the fever is oscillating. Right? उसको लग रहा है उसका थर्मामीटर खराब हो गया. Please pardon my spellings. And there is bitter taste in mouth. And there is trembling. I want all of you to focus on this symptom as well. Burning pain in throat. इसका क्या मतलब है कि उसकी जो नॉर्मल पेन थी अब वो बर्निंग कैरेक्टर में बदल गई है. What does this mean? So I'll share what I did. I'll give a hint. Yes, Hussain Ali, you are very right. I'm waiting, Hussain Ali. Phosphorus. Okay. क्या phosphorus का character है इसमें? Center of phosphorus. What was the first remedy proved by Hahnemann, sir? Tanush. Excellent, Tanush. You are bang on even before my hint. Exactly. But what cinchona? We need to see, na? There are so many cinchonas. But which China we are going to give and why? Somebody suggested arsenic also, which was very appropriate. But we need to see there is cold perspiration during the sleep. There is desire for uncovering, but that aggravates, that brings on the chill, shivering, rigors, right? And there is burning pain in throat. One important thing was nose obstruction lying while. ये छोटी-छोटी चीजें हैं जो जिसकी वजह से वो बहुत परेशान है कि I'm not able to breathe also. That brings China hours closer to the simillimum of this patient. Of course, even the water tastes bitter. And see, guys, friends, we need to understand the diagnosis as well. When the infection has started producing burning, that means there is some malignant pathology that has started. So I generally, China Ars is a very, very nice remedy. A very important hint for China Ars is restlessness in the lower limbs. So we have restlessness of lower limbs, burning pain in throat with obstruction in nose while lying. If these three things are present along with oscillating fever, it's a very important combination for prescribing China Ars. Don't miss this. But if we are thinking about China Sulph, there is a lot of heat that is produced from the vortex. In China Sulph, you will see there will be heat from the soles and hands and palms as well. Very, very important remedy. As you can see, arsenic modalities are there. There is burning. This is the indication towards arsenic. So after receiving the remedy, first thing what I want is that the pathology that is becoming malignant should reduce. His throat pain has started reducing. The oscillation that was coming in the fever has reduced. Fever is there, but has become more stable. Patient is able to, open his eyes, energy level is getting better, that profuse sweating is reduced, and he is able to sleep more peacefully because of that. Krishnamurthy ji, you want to say something? Or it is by mistake? I think it's by mistake. Potency,
no, asking about potency. I think the Krishna only.
Okay. I started with 200 and I had to go to 1M also. The dose was repeated as, and very important thing in fevers is when the fever is rising, don't give high potency, especially at that time. Give your dose in water potency and tell the patient when the fever is coming down, take the dose at that time, because vitality is able to express in a better way. Slowly the patient improved and got better. Let's do one more short case. This lady came to me. When she came to me, she was sitting in front of me, sneezing, a lot of sneezing, with chilliness in the body, with mild pains that have started. And she's saying कि कुछ थकावट लग रही है शरीर में, सिर भारी भारी हो रहा है, आंखों में थोड़ी दर्द शुरू हो रही है, और नाक से पानी बहना शुरू हो गया. Again, she's saying it is just starting of the symptoms. तो डॉक्टर इसको यहीं रोक दो, ऐसी कोई दवाई दो कि इससे आगे ना बढ़े. Not ready to give any other symptoms. Just give me medicine for this. Dr. Meenakshi is suggesting Natramur. And what's the reason for Natramur, Meenakshi ji? Anita ji, आप भी अपना reason बताइए, please. Why are you suggesting this remedy? And remember, this is not just one patient. Many patients during COVID times have come for this. And sometimes we need to have, good tips in our hands so that we can give solution to this kind of remedy. Tanush, very interesting, very interesting. Camphor is a very nice suggestion, but for camphor, for giving camphor, we need to have little more than this.
Right, Manish, this is Maninder actually. I lost from Tanush's ID.
Ah,
yeah.
I could see Dhiman, but there are so many Dhimans.
No, that's okay. That's okay. Thanks.
Okay. Very nice suggestion. Camphor will have that, lack of energy, and also camphor is a very frightened remedy actually. There will be a lot of fear and collapse like state that my body has started giving away, and I feel if I will exert, I will fall down. And my body is becoming very cold, little cold perspiration, जिसे हम ठंडी तरेली कहते हैं ना हिंदी में, वो कैंफर में बड़ा important है. Any more suggestions? So I have used this remedy a lot with very positive results. Let us read what is this remedy. Influenzinum. Let's see what Clark has to write. In place of bacteria as a routine remedy in epidemics. It may be given in low. I believe we can give in high potencies as well. This will be found sufficient to control a large proportion of cases. When the cold appears in a family, let all those who were unaffected take arsenic 30 thrice and let the patients take influenzinum 30 every hour or two. This generally prevents the spread of the trouble and clears up the colds, whether they are from influenza type or not. So we need to see how wonderfully these small tips can, help us. And similarly, that happened with the lady. There was little bit of repetition, but the cold went away. We could control the disease from further development. So far, everybody with me? Only use influenzinum in absence of other peculiarities. I used influenzinum because it was just the beginning, and see, in previous case we gave nux vomica because the coldness and desire to cover fully was present. That modality was present. In this patient, we don't see any modality. So this is a quick prescription, but in that quickness also we need to be very clear what we are doing. One more case is a 2.5 to 3 months old baby girl. So the family has gone through COVID. Now she got the infection from family, and because it's a prematurely, I think 7th month born child, out of panic, they started using antibiotics. And you know what antibiotics do? They kill the good bacteria as well, which is responsible for your immunity. And the moment they stopped antibiotics, she landed into pneumonia. And this child is in ICU with oxygen. I'm asking for the symptoms, but the attendants are saying they are not letting us go into there and observe the child that much. What will you ask from such a small child? Can you do something for this baby? That's the question attendants ask. And there I need suggestion from you as well. What are the possible efforts we can do here? That is all. Baby in ICU, premature, 3 months old, with pipes. In almost every hole. Very nice participation till now. Suggest anything that comes to you. Very nice, Meenakshi. Very good thinking, Carbovage. And I know why you thought carbo veg, because it's the remedy of deathbed. But there is think little bit more, and you will crack it. The remedy is almost in front of you. Just you need to use a different tool, a different thought process. Hussain Ali, Law of Cirrhosis, very nice suggestion. Because it's a lung tonic. You're thinking in right track. That's where we need to focus. The action of remedy has to be there. And again, on this platform, as Espidos, Verma, Senega, very nice suggestions. But the problem with these remedies is that we need to have some indication. For carbo veg, like cold sweat with fan desire, Lauro cirrhosis, you need to have that typical lung symptoms for Espidos, Parma, Senega, and Lauro cirrhosis. Okay, somebody needs to unmute. So, okay. Very nice, Anika. You are thinking in the right direction. I'll share what I did. Okay. Again, this is a very wonderful remedy you can use when state like this is present in front of you. Pneumococcus. Pneumonia is the main thing that we have to tackle. See, I need you to understand. A person is drowning in an acute state. House is on the fire right now. The question is of life and death. So, आप ऐसे टाइम में पेशेंट को हाथ पकड़ के इस एक्यूट सिचुएशन में से पहले निकालोगे या उसका कॉन्स्टिट्यूशन देखना शुरू करोगे, जो कि क्लियर कट नजर भी नहीं आ रहा, ना ही नजर आ सकता है इस टाइम. The family is in panic state. The child is unavailable to observe. But this remedy saved this child, and today this child is my regular patient. Just on the indication of pneumonia being set in, you guys must read Burnett. You understand his philosophy of it. This is the only thing we can see is the pathology that is becoming overwhelming. That is what we need to control at the moment. Pneumonia और ना बढ़े बच्चे का. And I have written some very important indications for you, and I have thoroughly used this remedy successfully during the pandemic with fabulous results. You see, if these symptoms are present, you will be double sure. Constant cough without expectoration, especially at night with nausea. Cough excited by entering hot room, very important symptom. So whenever there is a warmth, the cough will increase. And very interesting observation was whenever the patient is coughing, he's bending down. Sometimes it's not just the throat bending down, it's the whole patient bending down. Why? Because the pathology is spreading in the lungs. And that is producing a painful situation. That patient has to bend to ameliorate the pain. Very, very important indication for this was if patient had history of frequent bronchitis, especially in the infancy, and sensation of feather in throat. These are the physical symptoms. And mental symptoms, just see how amazing the mental symptoms are. Depressive condition with anxiety. This is all, I think, written by Julian Materia Medica, if you want to read. Desire to remain at home because of the horror of going out. And see how interesting this is. Loss of taste. I want you to focus on the word taste of life. Impression that he is going to break down and cannot walk. Collapse jaisa state. Fear of death with fear of becoming ill. That was the family symptom of the whole family. Very, very interesting remedy. So far with me, everyone, so we'll do just one or two more cases and then we'll summarize what is that we are going to understand today. So this 6-year-old boy came. I am Chota Don, sitting in front of me in a very restless way and very restless and discount. Doctor, check my throat, otherwise I will shoot you. I checked his throat, say, check my mother's throat, check my father's throat, otherwise I will shoot everyone. Why are you shooting everyone? I am Chota Don. Everybody was kind of getting entertained around because of such a small child behaving in this mischievous way. I saw his glands were swollen, history of recurrent tonsillitis. Every temperature and weather change, he will fall sick. Always constantly on allopathy. The moment allopathy stopped, he is sick again. The moment allopathy is given, he gets better, but again when it is stopped. So this vicious cycle is going on. And whenever this thing starts, the discharges are very ichorous. The skin starts becoming corroded. Parents we are tired of giving this child allopathy and we want to start with homeopathy and quit his English medication. We want to improve his immunity. So tell us, doctor, what you can do. Because why we get worried, the parents are saying, whenever these symptoms increase, he goes in an acute state, blood starts showing up in the expectoration. There is bleeding from gums while brushing. And history of recurrent pus formation and ulceration in the tonsils. And very offensive breath, especially in the morning. At that time also the breath was offensive. Come on, my friends, what are your suggestions for this child? Tuberculinum. Vivo, very nice. Hyper self-kill, desire to end threatening. Very, very interesting, Hussain Ali. Meenakshi, give your reason for. I would request everyone to change their name on the Zoom because Vivo is that's phone you're just promoting. Apna naam likho yaar, so that we can address you. Anjum is also very keen for Mark or Hypersolve as well. Very nice, very nice. Very bang on suggestions. Congratulations, everyone. This child was given Mark's hole. Why? Easy bleeding. the destruction sets in from the acute problem. Offensive breath, yes. And every, Maksol, what is it? It's put in thermometer. Every change in temperature and weather reduces the aggravation. And this is a, I want to show you influenza symptoms again. Purulent discharges, acrid discharges. Worse from warm, I need to, you to concentrate here. Worse from cold, worse from chilled, worse from warm, worse from wet. Their parents said he gets aggravated from every weather change. There is not a single change in the weather that does not aggravate him. And along with that physical picture, you need to see how audacious he was. Shooting everyone. The last 13 number symptom I want you to concentrate on. This is the state. He was almost like expressing the source, surrounded by enemies and shooting at everyone.
Manish,
Yes, Di.
पूनम भाटिया एफबी पर तुम्हारे ये लास्ट वाले पे मैसेज कर रहे हैं एरम ट्रिफलम.
Arum trifilum is very interesting remedy because arum trifilum has lot of porous discharges, lot of rawness, and again very similar. But the mental picture, see that audacity, see that expression of the child that is absent in arum trifilum. Antics playing. Everybody was enjoying this child because the child was expressing the source. Aurum trifilum itches till the thing bleed. There is a lot of itching and skin symptoms in aurum trifilum. But it's almost like even the center of the patient was expression was also syphilitic along with the pathology. So last case we'll do, and of course this child is still jovial. He still comes to the clinic, and you know he's audacious. He talks in that kind of voice. Doctor, aap mera gala check kar do. So little he has become, you know, he's not talking about shooting and killing that much. And he's not falling sick on every change of weather now. The discharge of blood has stopped. Of course, he's free of allopathy. The parents are happy that since whatever time he's with me, no, not even a single allopathy has been given. One more very interesting case this is, because this is a kind of case, ये ऐसे cases हमें बहुत trouble करते हैं. ये बड़ी खतरनाक बीमारी है. इसे कहते हैं pyrexia of unknown origin. योगेश सर ने आज नाम भी लिया था इसका. तो इसमें कई बार क्या होता है, समझ ही नहीं आता कि करना क्या है. क्योंकि फीवर है लेकिन उसका कारण नहीं पता. पास्ट हिस्ट्री है, टाइफाइड का ट्रीटमेंट पेशेंट ले चुका है, बार बार एलोपैथी खाता है जब भी फीवर आता है. सो टाइफाइड गेट कमिंग बैक अगेन एंड अगेन. अभी लेकिन टाइफाइड रिपोर्ट्स में एंटीबायोटिक्स खा खा के जो विडाल है वो नेगेटिव आ गया, बट स्टिल ही इज हैविंग फीवर. ही इज ट्रबल्ड बाय दिस, एंड बिकॉज ऑफ दिस फीवर पेशेंट हैज become very lethargic and slow, indolent. अच्छा, वो टीबी का ट्रीटमेंट उसे 2 बार दे चुके हैं, because that's the last thing left with modern medicine कि चलो ये करके देख लो. But that low grade fever 9900, that is not going away, and because of this there is a lot of effect on the patient because उसने कोई एलोपैथिक डॉक्टर, कोई होम्योपैथिक डॉक्टर नहीं छोड़ा. Patient was very well off and of a high position, so he called on the panel of doctor for the discussion of his case. And वो इतना आगे तक सोचने लग गए कि हो सकता है अंडरलाइंग कैंसर की स्टार्टिंग हो जिसकी वजह से फीवर आ रहा है. But there was no weight loss or something like that. Although the patient was saying, I feel I'm losing weight, becoming weak, but there was no actual weight loss. And वो कह रहा है इतनी मैं अब कैंसर वाली उसमें तो मैं रिसर्च में जाने वाला नहीं हूँ डॉक्टर, आपके पास कुछ है आप कर सकते हो तो ठीक है, नहीं तो मैं इस फीवर के साथ जी लूंगा क्योंकि मेरे पास और कोई चॉइस नहीं है. एंड वेरी his tone of voice was very निराश. We थोड़ा not having much faith in homeopathy because his previous experiences were not that great. So I told this patient, you stop all the medication for 2 weeks. Whatever happens, I'm there, don't worry. कोई इतना हाई भी नहीं जा रहा है फीवर की, कुछ हो जाएगा. And then come back to me after a few days. He said there is constant heat in the top of head because he's every day on dolo since so many years and months. He's taking antipyretics, sometimes abugesic, sometimes dolo, sometimes naphthol spas, whatever that, he keeps experimenting with that. Now he has become so big. He tells जब fever 99 से 100 भी जाता है ना, I become very slow and lethargic and become irritable. Little egoistic patient, don't tell me what to do type. कोई suggestion देता है family में उसको तो बोल देता है don't tell me what to do. I am in charge of my life. So strong ego I could feel in this patient. But when very interesting thing he told कि अब मैं ना अपने फादर को और अपनी वाइफ को बोल चुका हूँ, फैमिली का बच्चों का आप लोगों ने करना है, मेरे को तो खुद का ही मालूम नहीं है अभी, उनकी पढ़ाई खर्चा वर्चा तुम लोग देखो. मैं It's a kind of depressive state he has come into and he has stopped bothering. Imagine he is not having that feeling to care for his children also has gone away. Little past history that he had twice he had scabies which was treated with allopathy and very interestingly he told कि जो दो उंगलियों के बीच में जो जगह होती है ना वहां कुछ थोड़ा इरप्शन और इचिंग अभी भी है डॉक्टर, ये वापस आ जाता है कभी कभी. Then he applies some cream or and then it goes away again and again. But these things keep coming back. So bring out your suggestions for this last case. Hussain Ali ji, bang on. Bang on. Very nice suggestion. Anjum ji, even just amazingly wrong. Typhoidinum vivo 1902. We will think if क्या हमारे पास और individual symptoms नहीं है patient के, when do we think of nosodes? When the only thing present to us is just the pathological symptoms and the vital symptoms of that pathology.
FB पर भी एक आंसर आया है, ऑरम मेटालिकम बाय राकेश कुमार द्विवेदी.
Aurum.
Yes, aurum met.
I think he's thinking of aurum because of the depressive state he is going in. But you need to see aurum की डिप्रेशन कैसी होती है कि वो अपनी रिस्पॉन्सिबिलिटी को ना निभाने के कारण सुसाइड तक जा सकता है. यहाँ से उल्टा है, ये कह रहा है मैं जिम्मेदारी नहीं लूंगा, मेरे को खुद का देखने दो क्योंकि अभी मुझे अपना ही समझ नहीं आ रहा. So this patient is kind of selfish. और हम मरते दम तक बच्चों का ख्याल रखेगा, कुछ भी हो। The responsibility he takes on. So very nice, Anjum ji, congratulations, you have written the right remedy in bold letters.
One more answer.
Yeah,
Like Poonam Bhatia, acid fos.
very interesting. But acid fos में क्या चाहिए? वो desire for refreshing things along with this kind of depression and this irritability. Anita ji, आपने सल्फर बोला. Oh, I'm sorry, I missed that somehow. Bang on, Anita ji. Medal goes to you. I'm sorry, I missed that. Very interesting. But we need to again understand the journey. Loathing life. What is loathing life? You are dragging life. You are not no more interested in living. He's dragging his disease from doctor to doctor to doctor. But again, there are 65 remedies in this. What is most interesting is the second symptom of the case. That he is indifferent to the welfare of others. Selfishness. Don't tell me what to do. I am in charge of my life. Every suggestion is irritating him. He feels he is being contradicted. And a very peculiar physical symptom, which is again the remnant of scabies. Also, ailments from suppression of skin diseases between the fingers. Very few remedy, and sulfur and soranum are two very. So, how do we understand? This case has become miasmatic. Patient is revealing his miasm to us. What happened after the remedy? The evening rise of temperature that used to be there generally started to break off. The lethargy suddenly started improving. He could open his eyes and feel more energetic. He started to naturally have interest in his work and family. Very important sign of improvement. And he was surprised. इतने साल मैंने धक्के खाए डॉक्टर, ये कमाल कैसे ये छोटी छोटी मीठी गोलियों ने ऐसा. He was like really pleasantly surprised. And in the long run, of course, he improved and he became source of so many patients to me. Till date, he is just fine, comes to say hi, hello, that's all. So till now, what have we did? Let's understand what we have done till now, and let's rewire it in a very clear-cut way. What is fever? Fever is just a symptom, a general symptom, a response of our immunity. Are we going to treat the fever? There is something behind the fever that we need to treat. First, we need to diagnose. What is the cause of the fever? What is the main reason that is producing fever in this patient? So we have seen variable cases. I intentionally bought these variable cases because so that we can understand that every fever patient will come to us will have some different presentation, different cause. First case जो था उसका fever का onset बहुत sudden था. Last case जो हमने किया उसका fever slow pace में चल रहा है. चाइना आर्स का फीवर कभी ऊपर जा रहा था, कभी नीचे जा रहा था. So type of fever is different. And what stage of fever the patient is coming to us. Even अगर पहला patient जो है वो मेरे पास तीसरे दिन आता तो वो एकोनाइट शायद मैं नहीं देता because it's written for the first stage of inflammation, aconite works. Later stages are something else. और cause में हमें ये देखना बड़ा जरूरी है, is the acute cause intrinsic or extrinsic? क्या पेशेंट की अपनी स्टेट हाइटन होके एक्सप्रेस हो रही है फीवर में, या वाकई में कोविड ने ही इतना ओवरपावर कर लिया था, जैसे 3 मंथ्स के बच्चे को बाहर का कॉज ही इतना ओवरवेलमिंग हो गया कि हमें पहले बाहर के कॉज को ध्यान देना पड़ेगा. Friends, I'm talking to how to think, and this you can not only for fevers, you can apply in every acute case. Where is the disease located? Where is the disease located in Chota Don? It's very deep. He is expressing the source. He is shooting everybody imaginatively. कौन सी दुनिया में जी रहा है वो, तो कहाँ है इफेक्ट? जो इफेक्ट डालना है हमें मेडिसिन से, वो कहाँ डालना है? लेकिन वो 3 महीने का बच्चा है, वहां डिजीज कहाँ लोकेटेड है इस टाइम? A particular organ has got affected. So we have to maneuver our prescription according to where we are going to put the action of a remedy to produce the result in the present situation. अभी क्या करना है? दूसरा, उस जहां भी है, बॉडी में है, माइंड में है, या वाइटैलिटी में प्रेजेंट है डिजीज, लेकिन उसमें अजीब क्या है? एकोनाइट में अजीब क्या था? अरे एक हाथ ठंडा एक हाथ गर्म. चाइना आर्स में क्या हो रहा था? लेटते ही नाक बंद, सांस ही नहीं आ रहा, और इतना कोल्ड पर्सपिरेशन, इतना. सो यू हैव टू सी वो पिक्यूलरिटी कहाँ लोकेटेड है पेशेंट में, ताकि वो ही पिक्यूलरिटी एग्जैक्टली हमारी रेमेडी में भी हो, टू प्रोड्यूस कॉन्फिडेंट रिजल्ट. What kind of matching remedy we need to give our patient to have result? चूहा फूल खाना नहीं पसंद करेगा और हाथी हड्डी खाना नहीं पसंद करेगा. I remember we used to do this in childhood. Found it very interesting. Match the following. Homeopathy is nothing but match the following. Interesting, is it? So, what did Hahnemann found? Hahnemann found chamomilla somewhere inside the patient to give him. Here the aconite was presenting itself. And again, quick tips also we need to have for the beginning of our practice. मुझे फीवर हो जाएगा डॉक्टर, कुछ दो. ऐसे विल नॉट कीप सिटिंग ब्लैंक. नहीं, तुम मुझे पहले केस दो पूरा, तभी मैं तुम्हें दवाई दूंगा. Patient will go to another doctor. People are not having that much of patience sometimes, so we have to adjust. Thank you, Niranjan ji. Thank you. This China Arts case, see, extreme wandering pains in legs. क्या बोल रहा था पेशेंट? कभी काफ से थाई में पेन जाता है, कभी थाई से काफ में आता है, पानी भी कड़वा, और बर्निंग स्टार्ट हो गई थ्रोट में. डायग्नोसिस has to be solid diagnosis. We must know where this disease is going. अगर बर्निंग शुरू हो गई है, China Arts is very important remedy for diphtheria, malignant diphtheria. अगर हम इस पेशेंट को China Arts नहीं देते, probably he would have landed into that. And when this is the reason of oscillating fever also. Body aconite का क्या है? The constitution is robust. फीवर तू आजा, मैं तेरे को तोड़ दूंगा. So goes to high fever. Why? Because the constitution is able to bear that high standing fever. But चाइना में क्या होता है, एक बार फीवर हाई जाता है, पेशेंट की जान निकाल देता है, इतनी कमजोरी प्रोड्यूस कर देता है. तो क्या फीवर एकदम से डाउन जाता है, मर जाएगा इंसान, ये इतना फीवर झेल नहीं पाएगा. That is why the pathology is also very in the same pace. What other cases? And this, see, this pyrexia of unknown origin, the patient was expressing us, the latent cause has to be caught hold. That's the type of remedy we need. The whole constitution of the patient, body, mind, soul, everything was affected. And we had to find the latent cause to remove it. And after all this, after all doing all this, what next? What do we expect? मेरी दवाई देने से क्या होगा? क्या वो 3 महीने का बच्चा निमोकोकिनम देने से it's over? No. Patient is going to go into the life and have other troubles as well. So we have to be very clear कि ये prescription मैंने अभी पैथोलॉजी के लिए की है. जब पेशेंट आईसीयू से बाहर आएगा, I will need to prescribe other remedies as well according to the presentation. Varies from case to case. Not every case will get solved like sulfur this. That with one dose of sulfur or very minimal repetition, this patient was just fine. Depending on the case to case, we'll need to adjust variably. जिस पेशेंट को हमने एंटीसिपेटिंग फीवर के साथ नक्सवामी का दिया है, मे बी वो नक्सवामी का हो कॉन्स्टिट्यूशनली या ना हो, हमें नहीं मालूम, बट हमें कभी वो टारगेट नहीं छोड़ना. And we have to be very clear what would be my next course of action and when I have to stop influenzinum and introduce some other drug, when I have to stop pneumococcus and now this is the right time to produce some other remedy. So we have just reviewed all the cases along with this understanding, and I hope I gave 200 Meenakshi. अरे potency के पीछे सब रहते हो. It's not important. Potency, you start with 30. If your prescription is correct, it will produce some result, and then you can, increase it further according to the action of the remedy. So try to meditate, try to be restful in every moment of your life, because अंदर का शोर कम होगा तभी आप बाहर की चीजों को अच्छे से सुन पाओगे. And big thanks to their team, Pramila Di, Yogesh sir, Neelam ma'am. I know they are doing with lots of effort. We all are learning a lot daily from all of them.
Thank you, Manish.
This is my email ID and phone number. Anybody wants to have chat with me personally as well, but I am sure when you will reach Pramila Di, you can get all the answers as well. So thank you, Di. Any questions? We have still time left. Our session was from 3 to 5. So you're welcome to ask.
Everyone is doing thank you. Thank you, Manish. Thank you.
Thank you, Deep, for this opportunity.
एक तो आज ये सीखा कि खुद को काम रखना है, अपना शोर खत्म करना है, दूसरों का फिर शोर सुनना है।
जी।
तुम्हारा
हम तो
लास्ट
दोनों इकट्ठे हो जाएंगे।
हाँ शोर से शोर को नहीं टकराना है।
जी जी जी
That is
जी।
a wonderful quote. दूसरा मेरी हेलो बोलना अपने छोटे डॉन को, वंडरफुल केस।
Sure, sure.
और जब वो बड़ा हो तो उसको समझाना बताना जरूर कि वो कभी छोटा डॉन था।
Yes,
वो अच्छा
definitely.
लगा केस।
Right.
थैंक यू। फिर से आई थिंक
Thank you.
एक क्वेश्चन भी आ रहा है तुम्हारे लिए।
What is this? Difference between fever with chill and fever with chilliness. I don't, शायद मैं बहुत अच्छे से समझ नहीं पा रहा हूँ इस क्वेश्चन को।
चिली और चिलीनेस के बीच का फर्क है।
चिल सी एक चीज मैं शेयर करूंगा सबसे कि जो पुराना टाइम था बहुत ज्यादा एंटीपायरेटिक्स नहीं होते थे। जैसे आप बीबीसीआर रेपर्टरी निकाल के देखोगे उसमें फीवर का अलग से बहुत ही डिटेल में किया हुआ काम है। अब चिलीनेस इज बेसिकली अ जनरल सिम्टम, द होल बॉडी फील्स चिली। बट व्हेन यू आर टॉकिंग अबाउट चिल, उसमें आप चैप्टर्स देखोगे, द चिल कहाँ से शुरू हुई, वो पैरों से शुरू हुई, सिर से शुरू हुई, हाथों से शुरू हुई, घुटनों से शुरू हुई। Yes, there are two different rubrics. So we have to locate the location and onset also.
There are two different rubrics in Kundali repertory. Yeah, Kundali
I think
repertory?
Kunjali. He wants to say Kunjali, not Kundali. Okay. Jost Kunjali is the author of that repertory. But अभी क्या आजकल के टाइम में what happens is patient comes after taking lot of medication. And if you remember last case, मैंने क्या किया उसके साथ, मैंने कहा 2 हफ्ते तू कोई दवाई नहीं खाएगा, कुछ भी होगा मैं बैठा हूं। So we need to remove that uncover. अब उस केस में because the fever was not very high grade, low grade था, तो we could do that. But आजकल आप किसी पेशेंट को बोलो बच्चा बीमार 99 फीवर आता नहीं है और पैरासीटामोल लिबो जैसे एंटीबायोटिक एवरीथिंग, and this COVID has created so much panic, So to differentiate those chills and where it begins from has become kind of difficult. But they are of course two different things. If your patient is Jagannathi, you need to mute. If your patient is presenting you those symptoms, of course pick them up. But you need to be very careful in differentiating both the things.
एक और क्वेश्चन है,
repertory to use as beginners in fever.
Beginner in fever.
Jayant, I would say repertory is not important first. अगर आप अभी BBCR उठाओगे ना, I am sure you will become dead confused because you will see so many symptoms, chill beginning at this AM, that AM, and going away at that, heat produced in this part and that. So personally अगर मैं अपनी बात करूं, मेरे लिए हो सकता है और कुछ टीचर्स हैं जो इसके लिए बहुत आपको बिकॉज उन्होंने उस रेपर्टरी पे माहिरता हासिल की हो तो वो आपको वो सजेस्ट करें कि बीबीसीआर यूज करो या थेरेपेटिक पॉकेट बुक यूज करो। बट आई बिलीव उससे पहले आपको जो जो बातें मैंने कही है कि डायग्नोज करना, कारण फीवर का ढूंढना, उसका पेस देखना, वो ज्यादा इंपॉर्टेंट है। पहले रेपर्टरी का रोल बाद में आता है। एंड आई बिलीव आप कोई भी आजकल की जितनी मॉडर्न रेपर्टरीज है उसमें सब सिम्टम्स अवेलेबल है, कोई भी यूज कर सकते हो। फर्स्ट अंडरस्टैंड द केस करेक्टली, मैच द फॉलोइंग करेक्टली।
Maninder is raising hand. Maninder, please come forward.
Yes, hi Manish. It was such an informative lecture. Thank you so much. पर मेरा एक ना बड़ा बेसिक सा क्वेश्चन है कि अब जैसे these days most of the you're right, most of the times बच्चे भी डोलो खा के आते हैं, पैरासीटामोल के सिरप्स लेके आते हैं. So what is your action in that, because उसमें symptoms तो हमें hardly मिलते हैं. So could you just put some in that? That will be really great.
मैं अपना पर्सनली बताता हूँ. What I do with my patients is I educate them again and again that fever is your friend. Fever has come as an immune response. Don't straight away start giving dolo. 101 तक अगर बच्चा स्ट्रांग है 102 तक भी वेट करो. प्लीज डोंट गिव एनी एंटीपायरेटिक. हाँ, अगर उससे ऊपर जा रहा है, आप एंक्शियस हो रहे हो, बच्चा बर्दाश्त नहीं कर पा रहा है उसको, ओके गिव डोलो, बट नॉट जस्ट स्ट्रेट अवे, एकदम नहीं दो. एंड दैट आई डू विद माय प्रिस्क्रिप्शंस एज वेल. So it's only about education, and the moment they start seeing results, na Maninder, they start trusting you and doing that.
Yeah, you're absolutely
एक बार
right.
में नहीं होगा, वो बार-बार फिर आएंगे, सर हम एंशियस हो गए थे, हमने दे दिया.
Right, right.
मैं थोड़ा डांट भी देता हूँ पेशेंट को, to be very frank.
That's really wonderful. No, yes, no, I really agree with you, but the problem comes when you know the walking patients आते हैं अपने पास OPD में, है ना? And the ones with whom the trust level still has to come up. So what I'm talking about there.
Again, we have to find the center of pathology and match that with the center of remedy. Whatever is getting presented, we have to hunt for that peculiarity. I believe that takes a little patience and
उसको पूछ
थोड़ा
लेना
टाइम
कि
तो डेफिनेटली लगता है.
प्रमिला को पूछ लेना मम्मी को.
Right. Thank you so much. Thank you so much. Yes.
Again, if somebody wants to add on any answers, it's not that I know everything. दी आपको अगर कोई better answer है, संजय सर को, योगेश सर को, you can add on to the answers as well. Your experiences. Neelam ma'am, we have such seniors to learn from.
नीलम मैम, यहीं पर है हो आप? एक तो सबके बंद करे हुए हैं ना, तो आई थिंक वो भी नहीं है. योगेश अभी गए हैं 2-3 मिनट पहले.
Right.
थैंक यू मनीष. आज का सेशन काफी अच्छा था और काफी कुछ सीखा भी. छोटी छोटी बातें जो तुमसे सीखी हैं वो काफी काम आएंगी प्रैक्टिस में, आई थिंक सबके लिए.
जी. Thank you so much. Thank you to Dare.
नहीं, Dare तुम लोगों से ही Dare.
नहीं, आप वो जो पिलर होता है ना, सेंटर का, जो एक बिल्डिंग के सेंटर का ढांचा होता है, एक खंबा जिसको सबसे पहले गढ़ा जाता है कि ये खंबा अगर है ना तो बिल्डिंग कहीं नहीं जाएगी. वो आप सेंटर वाला खंबा हो डेयर का.
अच्छा मस्का है. आई
एम श्योर बहुत सारे अप्स एंड डाउन्स आए होंगे, बहुत सारे लोगों ने कहा होगा क्या कर रहे हो, बट द इम्पोर्टेंट थिंग इज टू गोइंग ऑन.
बिल्कुल 8 साल से चला रहे हैं. कोशिश तो है जब तक जिंदा रहूंगी चलाऊं, बाकी परमात्मा जानता है ना.
आप जिंदा ही रहेंगे जी.
लेजेंड्स
डोंट डाई. कौन भूलेगा लता मंगेशकर को. एक और बात मैंने सबसे कहनी है, प्लीज गो टू वोट टुमारो. डेफिनेटली कोई भी बटन दबाओ, डोंट मिस. इट्स वेरी इंपॉर्टेंट. पंजाबी सारे, whatever you have faith, just do it. Thank you everybody.
Thank you.
Thank you Dee. Yeah.
Okay.